So we're looking at part 28 of Hydrotherapy, the theory and practice, and previous episodes can be found on www.preparingforthetimeoftrouble.com, and upcoming episodes can be found there as well. So just an important reminder that as you navigate any health challenge, you partner with a medical practitioner who has a similar philosophy of care that you do, both in health and in sickness. The things we talk about here are just tools that you can add to your wellness toolbox for helping you stay well and or get well. Others have used these same tools in various ways. Shouldn't be construed as medical advice, just tools. And any treatment protocol or procedure, you need to make sure you check out thoroughly for yourself before just going and doing it. Back in 1903, the Newark Advocate published a quote by Thomas Edison that was very forward-thinking for the day, that the doctor of the future will give no medicine, but will give instruction to his patients in the care of the human frame, in diet, and the cause and prevention of disease. So they were focusing on the capacity to know what made the body run. And that was an important part of preventative medicine, which we talk about, but we haven't really seen implemented the way that Thomas Edison, I think, envisioned it. That same vision was referred to in a way even before that, in 1885, Counsels on Diets and Food and Testimonies for the Church. There are many ways of practicing the healing art, but there's only one way that heaven approves. That's a very strong, bold statement. God's remedies are the simple agencies of nature that won't tax or debilitate the system through their powerful properties. That's pure air and water, cleanliness, a proper diet, purity of life, and a firm trust in God. So there are many people that are dying for a lack of knowledge about these things. They don't go out of date, but the skills to implement them can go out of date. Just get lost in the progressive era that we live in, so to speak. So they do take time to implement, but those are well worth their time. So drugs are expensive, both in their cost. Anybody who's had a prescription filled is thankful for the copay because the prescriptions are outlandishly expensive, as well as their effects produced on the system. So thinking ahead to the types of things that would be encountered in the future, as well as in the current day when this was written in 1885. 3 John 1 verse 2 points to the importance of our soul being in the right place, that I pray that you prosper in all things and be in health just as your soul prospers. So we do need to take care in a special way of our spiritual walk and our walk with God. And he can show us, if we're willing, the areas of our health and lifestyle that need to be left along the side. Romans 12, 1 and 2 says, I beseech you therefore, brethren, by the mercies of God, that you present your bodies a living sacrifice, holy, acceptable to God, which is your reasonable service. And do not be conformed to this world, but be transformed by the renewing of your mind, that you may prove what is that good and acceptable and perfect will of God. So we don't want to be conformed to the habits and practices of this world, and we want to have our minds renewed by the Holy Spirit as we reflect upon and emulate the life of Christ as he lives through us. The Ministry of Healing talks about knowing our body well, the fact that we are the temple of the Holy Spirit and the temple of God. We need to preserve our physical powers because we're the temple of God. And we need to make it our study and understand what it needs and do our part in preserving it from harm and defilement. Defilement's a pretty strong word. There are things that we can do to our bodies and the way we treat our bodies that can defile it. So we're going to look at the use of full baths in hydrotherapy. So there are a variety of different ways that a full tub of water can be helpful and beneficial in hydrotherapy use. Most of what we've talked about so far has not been full immersion types of activities. So a full tub bath, you have most of the body immersed in water. You're going to be monitoring the temperature carefully, so you want to have a temperature probe handy. And then you're going to watch for the proper reaction throughout the treatment so that you get the result that you're looking for. So there's 6 types of immersion baths for home use: the hot full bath, the neutral full bath, a cold full bath, a cold shallow bath, a plunge bath, and one called the graduated bath. So those are the ones that we're going to look at tonight as we look at the different types of baths used in hydrotherapy. So the hot tub bath is not like a spa, but it's just a tub of hot water that you are immersed in. So the variables are the water temperature and the treatment time, and you can change the water temperature and the length of treatment. So those are the variables. Typically, the cooler the water, the longer the treatment. But typically, it's going to be running between 100 and 106 degrees Fahrenheit. So that's going to feel hot because body temperature is 98.6. Anything above that is going to feel hot. And this is going to be from 2 minutes to 30 minutes, depending on the type of reaction that you are looking for. So it can be used to prepare a person for a cold treatment. So that would be a shorter duration, getting them ready to have a full warm sensation and then have a cold treatment immediately following. So it can be a preparatory thing, just like soaking the feet in warm water can give an overall sensation of warming for the person before they have a cold treatment, like a compress or something like that. So you can have it a prolonged duration. So that 30-minute duration can promote sweating, which can be helpful in eliminating toxins and purifying the body. So elevating the body temperature can do a number of different things. It can relieve pain, can help relieve fatigue, and congestion of internal organs. So basically what it's doing is vasodilating all the tissues because of the full body immersion. And it can reach to the core fairly well, especially with a longer duration. And it causes vasodilation, increases the circulation. So some of the benefits include sweat promotion. Again, that's a toxin cleansing role. Can help in relieving the pain and rheumatism and muscle pain and spasms associated with various types of arthritis. Provide mild fever effects and benefits. So fever is one of the body's mechanisms of fighting off infection. And so it's a normal process of being ill, whether that be from a pathological basis or a toxin level basis. If it's a toxin, you're trying to exude the toxin away from you through sweating or other mechanisms of purging those toxins from your body. And then also increases the circulation and the metabolism. So by nature, when you increase the temperature of a reaction, you increase the rate of that reaction. So as you increase the body temperature, you increase the metabolism and the rate at which the body is processing all of its processes. Now, of course, you can get too hot. That's the danger in having a high fever on the neurological tissue, because that can cause denaturing of proteins and the breakdown of neurological tissue. So one of the most fragile tissues of the body. That's why we don't get temperatures, allow them to get above 102, 103, and the 104, and we're like danger zone, getting up in there. And that's where you would use hydrotherapy as a fever reducer. But metabolism generally increases with temperature and reduces with a lower temperature. So that's what actually they use temperature cooling mechanisms on surgical suites, not only to make it more comfortable for the doctors, but really to make it so there's less oxygen being used and they can prolong the time available for doing surgical procedures by cooling the body and slowing the metabolism down. So just interesting things with temperature and metabolism. So applying the full hot bath, you want to start the person in a neutral bath. So that right about body temperature, 98.6 or 98 degrees Fahrenheit, and gradually warm that to 100 to 106 degrees Fahrenheit. So you're going to want to have a thermometer right there with you in the water so that you can monitor that temperature. Start out with a not quite full bath so you have room to expand that temperature with additional water. You want to bathe them 2 to 20 minutes, but not longer. It could be 30 minutes is fine too, as previously mentioned. But excessive hot bath can be detrimental, so don't go too long. Provide cool drinking water and keep the head cool, because it can elevate the entire systemic temperature of the individual, and helping to keep the neurological centers, the central nervous system, cool is important. It could be necessary for someone with heart issues, increased heart rate, or other known issues, to use an ice bag for that. And that helps, especially with an increased heart rate of someone who's in the tub already. So you may also apply ice to the back of the neck if necessary to cool the person. So once they've been in the bath for a particular period of time and they're ready to get out, unless it's just a warming for a cold treatment, you want to finish the bath in one of three methods: gradually cooling the hot water by adding cold water. So you want to, again, judge the size of the tub to allow for that cooling addition of water. You could do a cold pail pour over the individual. So this would be someone who is already robust, healthy, strong, not feeble. So the shock to the system won't be excessive. So that's kind of a more extreme finishing mechanism. And then the third would be taking a cold shower or a cool shower immediately following the treatment to rinse down. And part of that is rinsing off any toxins that might be sweated out or released from the pores. So a note of caution: you don't want to use if the person has heart valve issues, heart disease like hardening of the arteries, because you're not going to get the vasodilation necessary associated with that. Diabetes, essentially because of the nerve tissue not being sensitive enough for the hot water. People with high blood pressure, other vascular diseases, and certain types of malignancies or cancers. The neutral bath or continuous bath is another way to say it. It's just below body temperature. It's not hot. It's almost, you almost can't tell you're in it, but it's applied as a relaxing measure. Someone who has trouble sleeping, insomnia, can help promote sleep. It helps to promote uniform circulation throughout the body. So again, it opens the blood vessels because it is warmer. And if there's areas of congestion, it helps to promote movement through those areas. It helps to reduce congestion of the brain and spinal cord, the central nervous system. And it's something that you can use just prior to going to bed. Helps to relax nervous tension. So someone who's had a very tense nervous day could be helpful. Anxiety can be beneficial with chronic diarrhea too. Multiple neuritis, so various nerve inflammations, and burns. So it doesn't have to be a total bath. Like if you burned your forearm, you could do a neutral bath, just the forearm area. So it could be the whole body or just a specific area. Nervous exhaustion or irritation. So someone with that would also have insomnia, and that can just help soothe the nerves and calm a person down. Blood and vessel diseases like diabetes and arteriosclerosis, a hardening of the arteries, essentially have arterial plaques of cholesterol building up that restrict the vasodilation, vasoconstriction aspects, the opening and closing of the arteries. So the neutral bath, the continuous bath, is good for that, because you're not going to be calling for an accentuated change in blood vessel size, but it does promote continuous blood flow throughout the body. So it helps to reduce blood congestion in the brain, especially in brains that are overexcited. Can be helpful in individuals with mental disorders like insanity. The neutral bath equalizes systemic circulation. And it can be used for days at a time under observation and care, not something you would just put someone in and walk away. Someone could slip in and drown, and that would not be a good idea. So it can reduce brain congestion and increases brain nutrition and has a calming effect on the brain. So this is a neutral bath or continuous. It aids the return to normal neural homeostasis. So they're not overexciting the nerves and having them firing and having someone be just jittery and just over the top. So the top picture here is a person in a tub with a blanket over top. We'll talk about how sometimes individuals will actually be suspended in the tub, so they're not actually touching the bottom with their body. And to do that, and also for this covering over the tub, it really necessitates having a tub like is shown here, kind of a clawfoot tub, because you can actually wrap straps around it and hold the towels over top. That helps to retain the heat and maintain a draft-free environment. So it can be very helpful in that regard. So in a manic state, you want to just pay really close attention to the person. It may require wrapping in a sheet pack prior to immersion, just to prevent thrashing and struggling. More time equals greater sedation, can be duration of hours to days. And if days, the person should be removed 1 to 2 times every 24 hours to take care of bathrooming issues, and also to oil the skin to prevent degradation or maceration of the skin. So the continuous flowing bath with a wet sheet pack was actually found to be very, very beneficial for various forms of insanity. So this was used in, you can use it in a home setting, but it also was used in a clinical setting. Some people may have looked at this as being rather extreme, but it was well noted that it had a very relaxing effect upon those who were treated with it. Whether they use this today or have just gone completely to the drug paradigm, which is my hunch, because this takes some effort, takes attention, where if you can just put someone on a drug and walk away and then check them again, it's more of a hands-off approach. But there are lots of detrimental effects associated with having a drug-induced state versus one that can be calmed through natural mechanisms. So application, here's a picture of a hospital where a number of people are at the same time in a neutral bath situation. Just as an example, again, the clawfoot tub with the tarp or the blanket sheet over top of it just to prevent evaporation. But you want to have the water covering the shoulders at a temperature of 94 to 97 degrees Fahrenheit. And you want to place a towel on the edge of the tub as a pillow, just to rest their head. Sometimes the feet will be out, but you want to cover the body area that is in the tub with a sheet. You want to keep the face cool, sponge with cooled water, and just evenly maintain the water temperature. So typically this will be done for up to half an hour, but if in extreme situations like insanity or manic types of situations, it can be for days, so like 34 hours or longer. When finishing this continuous bath, you would cool the water by 2 to 3 degrees at the end. So that would be, if it was starting at 94 to 97, you finish up at around 92 to 90 degrees Fahrenheit. So dry gently and quietly, dim the lights, and assist them to the bed for sleep. So this would be especially true for someone with a shorter duration who's trying to get to sleep and insomnia is an issue. So don't use if there's excessive heart weakness associated with the individual who's being treated. And there's some eczema cases that don't respond well to this continuous bath, neutral bath. So the continuous neutral bath is helpful for a variety of different issues. People with extensive burns can help with them, help with pain. Paresthesia, which is just general numbness and tingling, various muscle spasms, someone who has itching all over their body for whatever reason, pemphigus, which is a skin condition with epidermal blistering. It's not common here in the United States, but around the world it can be found, and it can just help soothe that. Extensive gangrene can be helpful for that, the whole continuous neutral bath soak. Profuse offensive pus from various open abscesses makes me think of the 7 last plagues and the noisome sore. It's just what came to mind as putting this together, and it could be helpful, but I'm sure that will be beyond comprehension. Foul smelling fistulas. So fistula is like an in-pocketing of tissue that can harbor bacteria that grow in there. It can also bring quiet and rest to people with agitated mental issues, mania, or alcoholic delirium tremens. Again, the type of tub that really seems to fit best with this soak is a clawfoot style tub, just because you're able to drape it with the towel, and that doesn't work out so well with the typical shower type tubs that we see in most homes today. So in applying a continuous neutral bath, if you use for a prolonged period of time, use a hammock or a sheet in the tub. So this is not a typical tub here that you see. It's a jetted tub. It's actually outside, but it has a type of hammock inside of it. So the person is suspended and not actually lying on the bottom of the tub. And that helps to relieve pressure points by having uniform, and it gives them actually essentially of weightlessness. And that can be accomplished with a sheet in the tub or a hammock type of arrangement. And that's where that clawfoot tub would come in again, or some kind of anchor points in the wall, which you'd want to think through in a home setting. A rubber pillow for the heads and heels, because those are contact points. And then some recommend keeping the feet elevated out of the water, doing the continuous neutral bath. So if they're continuously in this bath for a protracted period of time for whatever reason, there's some daily routines that need to take place. You want to assist the individual out of the tub, because they probably will need some help. Their muscles will not have been active during that period of time. You want to cleanse with a soapy bath, a soft brush or cloth, and then have them exercise just very lightly following that, get some blood circulation going. And then do a lanolin or Vaseline rub as appropriate. It helps to protect the skin, because you know how if you've been in the tub too long, your skin starts to wrinkle up and like begins to soften. It can start to break down if in the water too long. While the person is out of the tub, you want to make sure that the tub gets completely disinfected, and run some fresh water in the tub before re-entering. Make sure it's a nice clean re-application. So then we have a shallow bath, and the shallow bath is one of the most powerful tonics and tends towards health. I just was thinking about a bird taking a bird bath as I was thinking about this, because it is a similar type of a way that one would take a shallow bath. If you're only in 4 to 6 inches of water in a tub that's between 65 and 75 degrees Fahrenheit, you want to pre-warm the feet and keep the head warm with wet towels so that they have a overall feeling of sensation. And then they're going to sit in the tub and vigorously rub the extremities and torso. The assistant can rub their back as well. So it's just going to be a vigorous rubbing. You're going to dipping and splashing water from the tub. You can do just a brisk lie down in the cold water, rubbing the legs 1 to 2 times and sitting up. So it's not a total submersion in a high volume of water, but in just 4 to 6 inches of water. Hence the bird bath notion. So just think about that as the way it should be utilized and implemented in a person who is using the cold shallow bath. About 24 minutes of implementation, and the person should glow. Basically, their surface of their skin should be stimulated, should have circulation increase. So the rubbing, as you remember, it magnifies the intensity of the cold and will just bring some great circulation to the surface. If you don't have that glow, there isn't an effect. The effect has not been achieved. So you might want to take a break, get a good rest and a warm up from that before trying it again, or you may need to try a different type of a treatment. So the warming effect will follow, just like doing a contrast shower. You finish with the cold, and then it has an overall warming effect at the end of it, or a cold wet sheet wrap as well has the same warming effect overall. And then there's the plunge bath. So the plunge bath is just a quick dip in a cold tub of water. It can be shallow or full. If it's shallow, you're going to do more splashing and less immersion, and that can actually be tolerated maybe better by most people than a full bath. So you can build up to a full plunge bath if desired. So this is going to be cold water. So they have plunge baths of all different types. You can even do it naturally, just out in a hole cut in the ice. So it's a tonic bath that tends towards health. It drives the circulation of blood to the core of the body. So there's something known as the diving reflex, especially if you do a total submersion. When your face is immersed in ice water, it shunts all the blood to the core of the body. And that's why, particularly in kids, if they fall through the ice, they can survive for some time underwater because of the diving reflex shunting the body to the blood to the neurological centers, and they can come out and survive with minimal to no damage to the neurological centers with the diving reflex. But we all actually have that, and it causes a plummeting of the heart rate and it's a body survival mechanism. But that driving the body's blood to the core helps permeate and push the circulation through all the organs of the body. So it's a quick in and out versus a long, cold, shallow bath. It's not nearly as powerful as the cold, shallow bath, but it's more tolerable, and it can be done with brevity and in a short amount of time. So the graduated bath is a prolonged bath, begins warm and then slowly cooled. So the benefit is that it's great at lowering fevers. So someone who has a fever, get in a warmer bath. Sometimes people that have a fever are chilled, sometimes they're hot, but you're going to be attempting to lower their fever. It's easier to take than a prolonged cold bath. So you're just lowering it, kind of like the proverbial frog in the boiling pot of water. As the temperature rises, this is going in the opposite direction, increased cool or decreasing temperature. Helpful for typhoid fever, and also a treatment for healthy people. Just helps to promote health. That's what a tonic does. So start with body temperature water, 98 degrees, and then that's going to be 3 to 5 degrees below the oral temperature if they aren't at body temperature. So if they actually have a fever, so 5 degrees above would be 103, for example. So you want skin warm before the bathing process begins. And then in this particular, you want to use a tub hammock or a sheet. So a cold compress of the head can assist that as well, gradually lowering the bath to 85 degrees. So it's not going to be cold. It's going to probably feel cold to the individual being treated, although it's not super cold. When the patient, if they're chilled or get goose flesh presents itself, rub the person to keep the blood at the surface rather than having it driven to the core. And then that helps to prevent and reverse chilling effects. You can also use a hot water bag to the spine to help raise the body temperature. So while they're in, you want to make sure every 15 minutes or so you're monitoring their heart rate and their body temperature. So have a thermometer handy to do body temperature. They have some handy forehead monitoring thermometers as well as oral thermometers that can measure body temperature. So when you complete the graduated bath, wrap them in a sheet, dry them briskly, and rub until the blood comes to the skin. Not that they're having their skin bleed. They're not in. That's not the situation. They're just having the circulation returning to the skin. If they're really cold, you can do a hot blanket pack. So sometimes you can have the temperature, the fever reduced where the person ends up kind of having a chilling effect. Have some pre-warmed blankets handy so you can wrap them in a hot blanket, or use a cold mitten friction. So again, that will stimulate circulation and return circulation to the skin.
To be aware of new videos like this one, be sure to subscribe to the Preparing for the Time of Trouble channel. For more free videos and downloadable audio podcasts, as well as handouts, go to www.preparingforthetimeoftrouble.com. Topic categories include recordings of live seminar presentations, country living, sustainable gardening, homestead remedies, how to be self-sufficient when the grid goes down, wild edible and medicinal plants, hydrotherapy, and end-time Bible prophecies. To take advantage of these free resources, go to preparingforthetimeoftrouble.com.